Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. This is KMET 1490 AM ABC Radio News, and I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist, and I'm here along with my best friend for the past 17 years. Did I say that?
You said it. You always push it a little bit.
I did. This time I did.
Okay.
This time I did.
Okay.
Right. And my business partner and colleague, Dr. Robert Jaffe. Welcome, Dr. Robert Jaffe.
Thank you. Thank you. Thank you. We are here this morning. Beautiful sunny morning in December. We are so lucky to be in this part of the country where it's sunny and it's warm and it's just beautiful.
Exactly.
And people keep moving here for that reason.
Yes.
So today we talk about addictions, codependency, relationships, and trauma.
Yes.
And we talk about that because it's so prevalent in our world, in our society. Addictions plague so many millions of people, all types of addictions, and even people get into addictions where they don't recognize that they're in an addiction.
And I think that's a very important point.
It is an important point.
People get into addictions, they are in it, they have no recollection or recognition of it.
Exactly. And we here believe that the largest one is that of codependency. We've talked a lot about codependency on other shows, and we're going to talk about it some more today. We started talking a while back about how codependency becomes physical illness, and we're going to talk more about that today and expand on it. We would love for you to join us and not just listen, but also participate. If you want to give us a call, that would be wonderful. Our phone number is 951-922-3532, 951-922-3532. You can call us anytime during this hour, and you can ask a question, you can share an experience. You can do it anonymously. You can just say, I'm not going to share my name, or give us a made-up name. That's fine. And we would love to hear from you and let us know what you're thinking, because the more you do that, the more we can tailor this program to your needs.
Exactly. Very well said.
Thank you.
You're welcome. So we know that, I just scary for me. I was just going to, and I kind of choked right now, actually. I was going to say, during the past year of pandemic, and I can't, well, it's not quite a year, but, actually it is a year that, the first signs of COVID, started to show, right? So it is a year that, the whole world is going through this trauma of COVID.
Yes.
And then the isolation that came along with it as part of survival, right? Has actually, added to addictive behaviors.
It has, yes.
Right.
Yeah, and that's because addictions are usually about stress.
Yes.
Right? Some of the stress is conscious. We're aware that we're stressed, and we use the addictions as a way of getting some relief from the stress. And of course, addictions work. They do give you relief from the stress. What we say here is you get relief from using your addictions, but you don't get release. And so the stress actually just gets recycled,
right.
but it gets suppressed, and you feel better for a short period of time. Otherwise, the addiction would have no meaning, right? People wouldn't do it if they didn't get something from it. So, and then of course, if you don't recognize that you're in an addiction, like most people don't recognize that they're in a codependent reality, they may be in a codependent relationship with a significant other, or they may just be codependent with people. And what does that mean? That means that they look to other people to relieve their stress, right? That's what addictions are. We look to people, places, and things to relieve our stress. And what can relieve our stress? Television can relieve our stress, cigarettes, um, marijuana, alcohol, cocaine, gambling,
workaholic.
Work can really work can take us out. Actually, people say, "Well, I'm stressed from work." There's actually two types of stress. One we call eustress, EU stress. Eustress is when something positive happens. Our body stresses, but it releases endorphins. It doesn't release negative chemicals. And then there's the other kind of stress, which we call distress, right? The damsel in distress. But it's not just women, it's men as well. And when we are in distress, then our bodies release chemicals that give us a jolt of energy. But that jolt of energy doesn't do anything to finish the stress. It just recycles it. So what is it? What is one of the chemicals is adrenaline. Mm-hmm. So if you're gambling, then you may have eustress, or you may have distress, or you may have both. And so what happens if you're gambling? Let's say you're playing the game of craps with dice. You throw the dice, and 7 or 11 wins, and if you get snake eyes, 2 or 3 or 12, you lose. And so you throw it, and you get a 7, and you go, 7, I win, and there your body goes. Or then the next one, you throw snake eyes, you throw 2, 2, I lose, and your heart starts racing, and your body starts producing adrenaline and cortisol, which is the other big chemical, and those chemicals start to give you that rush and get your heart pumping, but then it doesn't ever exit your body. So it stays within your body, it gets recycled, and eventually can make you feel not good.
Yes, yeah, all that piled up extra, rush of hormones, and the process of it, the tiredness of it, eventually, gets us.
Mm-hmm. And so what we now know is that physicians spend most of their time actually treating stress-related illnesses, and of course, stress-related illnesses can manifest in a number of different ways. And one of the things that I want to comment on about codependency is that codependency starts with can begin. It can begin at any time in life, but often can begin in early childhood. We say that when a child is born, they are dependent, right? They're totally dependent. They can't do anything for themselves. They can signal when something is wrong, and they signal that by crying. So if they're hungry, or if they're uncomfortable in some way, or if they're frightened, they will cry. My goodness, we've got some company.
Yes.
So sorry. I think we've got some workmen up above us, and unfortunately, they're not supposed to be doing this, but I guess they don't care. So
right.
We will just make the best of it. And so what was I saying? I was saying that
you were talking about physicians treating distress.
Treating distress,
right.
and that
the stress.
And then when we're born, we are all born dependent.
Right.
What are we dependent on? We're dependent on another person to take care of us, because we cannot feed ourselves, and we cannot change ourselves. And so, knock, knock, knock.
I guess we just have to ignore it.
I'm trying. But you know what they say about trying.
Yes.
When you're trying to do something, you're not doing it. So,
You know that this is not the first time, that I'm experiencing this.
Yeah.
I don't know how strong you hear it in your office.
I hear it pretty strongly.
Right. Okay. So then, and I have gone up to check to see where this noise is coming from.
And I have too.
Yeah, and everybody declined, so nothing's going on in their suite that they are above us.
Right.
So I guess it is something that's happening on the roof. I don't know, but the
perhaps.
reality is, they're not supposed to do it during working hours.
Correct.
So
Yeah. But we know about the word supposed to, right?
exactly.
Yeah.
So we are sorry about the inconvenience that this may have caused.
Yeah. And I'm going to do my best, and you're going to do your best to try to move on.
Right. The show must go on.
The show must go on, and we're so. So I want to say a little more about dependency. So we are dependent for a long period of time, relatively in the animal kingdom. Most animals are not dependent as long as we are. We're dependent usually for the first, maybe I would say pretty much till maybe 16, 17 years old. We're not able really to take good care of ourselves.
Well, yeah, maybe that's because of our, level of age, expertise, financial dependency. So maybe we're a kid.
We're children,
yeah.
and human beings have very complex lives.
Right.
So to be able to integrate all of that information and then to be self-sufficient takes a lot of maturity.
Right.
And of course, maturity doesn't automatically come with age, but hopefully, as we get older, we mature and learn how to better take care of us. So, but we pass through that age of dependency, and then we learn how to do things for ourselves, and then we move from dependency into independency. Now, and we say to our parents, no, I can do that. I don't need you to help me with that. And even though our parents may be better at it, whatever it is, we still want to do it so we can learn, and we do. And then we reach the final stage of maturity, which is in interdependency, and that means that I can take care of me very well. And if I'm in a relationship, then you can take care of you very well, and we do that. We take care of ourselves. But sometimes when we get stressed or when we get ill and we can't take care of ourselves very well, we can allow the other person to take care of us. So we can allow the dependent part of us to surface, and we don't have any problem with that. We can allow it. And then of course, if we get really good, then we can have children, and then we can take care of ourselves, our mates when we need to, and our children for the first, let's say, 16, 17, 18 years of their lives. And then we've reached a high stage of maturity.
Exactly. So we just got our notice of commercial break, and we will continue to discuss this important matter of life that pretty much, majority of people are involved in it. The dependency, the getting out of it, to get to the mature level of interdependency. And we will continue with our discussion after commercial break.
After commercial break, we'll see you soon.
Recovery seminar every Thursday from 3 to 4 p.m. Please join us. Thank you. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. For those of you who just joined us, welcome. And our topic for today is codependency, addictions, trauma, and relationships. And we would like to invite you to please call us, join us, share your perspective. Share this program with those that you believe they can benefit from it. Our phone number here live is 951-922-3733. 3532. And also you may, contact us privately. Our email information is on the webpage at radio station. And we appreciate any feedback that you can give us so we can better serve you. Thank you. So, Dr. Jaffe.
So we're talking about how codependence can become physical illness. And we were just talking about the 3 stages of maturity: dependency, independency, and interdependency. And so there was a talk show host, a psychiatrist in the 90s, whom I admired and liked a lot. His name was Dr. David Viscott. And when people would call him, he would actually do therapy with them on the phone, which I thought was a little cavalier maybe, but he would do a pretty good job in the couple of minutes that he had. And people would call up and oftentimes they would say, well, I'm a codependent. And he would say, what do you mean co? And he kept saying that. What do you mean co? Basically, what he was saying is that codependence is really dependence. And you're dependent on someone, and that person is dependent on you, and that's why you call it co. But it's really a stage of dependence, and dependence means that it's hard for you to make up your own mind, to trust yourself, that what your thoughts are, what your opinions, what your feelings are telling you are the right ones for you. So what you do then is you take a survey, and you go around and you ask people, well, what do you think about this? What do you think about this? What do you think about this? And then everybody will give you their thoughts about a certain behavior that you're doing, or certain feeling that you're having, and then from that point you make up your mind and you go, okay, I guess it's this.
And that's the key word that you just said. I guess it's this.
I guess, yeah,
so
yeah.
You're not even sure.
Exactly.
Yeah.
You're never sure, because you haven't learned how to trust yourself, and that, of course, is what dependence is. When the child is coming into fruition, and they're 1-year-old, 2-year-old, 3 years old, they don't really know what's going on. They don't understand what their feelings are. They don't understand where they come from. They don't understand what's appropriate and what's inappropriate behavior. And so they're relying on someone else, usually their caretaker, let's say their parent, to inform them. And if the parent does a good job of that, the parent then helps them understand what it is that they're going through. So I used the example of my daughter, because I think she's really doing a great job with her 2 twin 2-year-olds.
She certainly is.
And she talks to them about their feelings. And so if one of them is disappointed, if one of them gets their feelings hurt, or gets physically hurt, maybe they bump into something, or they slip and fall and they're physically hurt, she will say to them, "Oh, you hurt your hand, and that's that, and your hand is aching, and that's why you're sad, and that's why you're crying." Or, your sister took away your toy, and you're very mad and disappointed with her, and you don't want her to take away your toy. Maybe you can even say to her, "Don't take my toy away," And
to be assertive.
To be assertive, and also to understand what the feeling is that the child is experiencing, so the child can then identify as time goes on what that feeling is and how to work with that feeling. And if the child isn't being obedient, then my daughter will say, you really don't want to do what I'm saying, right? You're really telling me, with your behavior, you really don't want to do it. But guess what? If you don't do that, then we're not going to be able to da 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 da.
Right.
See? So she will explain it. Now, is she perfect? No, but she's a lot better than a lot of parents who try to use power plays and punish the child without explaining to the child really what's going on.
Right.
But that's the stage of dependence. And so as people grow older, if they haven't negotiated that dependent stage successfully, and they haven't gotten their needs met, they often may learn how to be independent in certain ways, but still carry over a lot of the dependent qualities that they've had from childhood, meaning that they don't understand how to work with their feelings. So you can have adults who throw temper tantrums, right?
Absolutely.
Yeah, and you can have adults who become very snarky, let's say, or sarcastic, and that's because they're feeling upset or they're feeling annoyed, and they're not expressing that they're feeling those things. They're acting it out through their behavior, and so that's that. And the other thing is, we don't know where we end and another person begins. Where's the line drawn?
Mm-hmm.
So do I cause you to feel something? And that's the basis of codependency or dependency. Is we believe when we're little that the other person causes us to feel a certain way because the process goes so quickly. The person is treating us in a way that we don't like, and all of a sudden we have that reaction, and we link that reaction to the other person's behavior, and therefore in our mind we believe the other person caused it. And what we don't realize, of course, because we're too young to realize it, unless we have someone to explain it to us over and over again, because you can't just explain it one time and expect the person to get it. But over and over again, we begin to realize, oh, this person did that behavior and I chose to react this way. And guess what? I have different choices. I don't have to react that way.
Yes.
So, for example, you take my toy and I pull your hair. Right now, if I can say, oh, the reason that I pulled your hair was because you took my toy, but actually, what happened was you took my toy. I felt angry, and I made a decision to act out my anger and pull your hair.
Exactly, and that's just such an important point because people think that between couples they come in and they say, if she wouldn't have done that, I wouldn't have hit her. If he wouldn't have done that, I wouldn't have burned the food, for example. Right.
Yeah. So it's a belief that we are not responsible for our feelings, that other people make us feel a certain way.
Yes.
Yeah. And the only way that another person actually makes you feel a certain way is through physical touch. Physical touch does make you feel a certain way. If you're rough with somebody, that person is going to feel that. If you're gentle with somebody, that person is going to feel that. So yes, your feeling is directly connected to your nervous system, and your skin is going to transmit that. However, short of physical touch, other people don't actually make us feel a certain way. And so we started to talk today about how codependence becomes physical illness. And what that means is that when someone acts a certain way and we have a reaction to it, and that reaction is a negative reaction, and we don't know how to release that, because we talked about addictions giving us relief but not release. We don't know how to release that. How do you release a feeling? Well, number one, you name the feeling, and number two, you own it. You say, this is my feeling. You didn't make me feel that way. So if you say something, and let's say you're speaking to me in a sarcastic way, and I don't like it, instead of my holding on to that and internalizing it and it becoming recycled in my body, I can say to you, you're speaking to me in a sarcastic way and I don't like it. That's expressing myself and expressing what's going on inside of me, and saying and getting it out of my system. So assertiveness is a way of releasing the feeling.
Exactly. And I know my experience has been that people who talk in a sarcastic way, that's actually a safe way for them to express all those untold feelings, unexpressed feelings, and the level of anger and other feelings associated with a given situation. So sarcasm kind of And then some of the people who are sarcastic actually talk in a funny way, in a joking way,
Mm-hmm.
you know, to make the other person laugh, and that's how they get the attention of the other person, right? While they are actually expressing something much deeper,
Yeah,
about themselves.
yeah. Someone once said to me that sarcasm is hit and run hostility.
Yes.
Hit and run hostility, and that always stuck with me, because hit and run means that I'm going to hit you, and then I'm going to pretend like nothing happened, right?
I
So
like that expression.
yeah, so I punch you in the arm, and then I look away, and you go, ow, and I go, what's ow? And you said, well, you just hit me, you just punched me, and I go, no, I didn't.
Yeah.
No, I didn't. And so you're left with a sore arm, but the bottom line is that I'm in denial that I've done anything,
Mm-hmm.
right?
Yeah.
I don't want to own that I'm upset with you, or that I'm angry with you.
Right.
Yeah.
And I'm afraid to say it straightforward.
You're afraid to say it directly.
Yeah.
And so being able to name our feelings, being able to say, well, this is another thing that David Viscott said that I just love. He said emotional health is really nothing more than the ability to say ouch in the now moment.
Right.
Right. Because when we feel that slight, that slight towards us, when we feel that hostility, when we feel that sarcasm, when we feel that condescending attitude, if we can name it and say, you know, what you just said sounded very condescending to me. I didn't like it. In that moment that we're naming it and we're calling it out, we're releasing it from our body.
Yeah, that's true.
Yeah. Now, what if the other person says, well, you're oversensitive, you know, and I've heard that a lot, you know.
Oh, me too.
Yeah, you're taking it the wrong way. You're oversensitive. And that has to do, again, with trusting yourself to say, well, by your definition, I may be oversensitive, but I'm perfectly sensitive as far as for what I need. And I didn't like it. I didn't like it when you did that, and I'd really like it if you wouldn't do that anymore.
So how about, you know, if you and I practice that? Ouch.
Ouch. Ouch. Exactly.
Every time we feel ouch, let's say it.
Exactly. And I try to help my clients to say that. Yes.
Yeah.
Yes.
Yeah.
And then, of course, usually people are reluctant to say that for that simple reason that the other person is going to try to reduce, you know, put it back on them. Oh, you're too sensitive, you know, or you misunderstood.
Oh, I've been told that on a few occasions, with people that I least expected to say that to me.
Mm-hmm.
And I have told them, you know, similar to what you and I just talked about, which actually caused the more chaotic, you know, response back to me, you know, and so and but once I realized that people are not. Some people are not able to understand, you know, that when they give a comment of that magnitude, you know, it's a reflection of how they're thinking and how they're seeing things and how they're experiencing things and how they're processing it for themselves. So they're not really understanding, you know, my position of how what they have said it has been hurtful or has been, you know,
yes,
not helpful at all.
Yes.
You know.
Yes. So absolutely. Yeah. They're not letting in your thoughts or feelings.
Right.
They're not taking them seriously.
They're not taking it seriously. So when you say you're too sensitive, it is as though, you know, you're wrong, or, you know, you're not supposed to feel your feeling, you're not supposed to express them, you know, what's going on, or, you know, it's completely denying of my state of feelings and reality.
Yeah, it's denying the other person's reality.
Right. And then, you know, I need to be like them in order to be included, to be, you know. So yeah, I mean, it's a complicated situation, but once one person understands it, suddenly all the chips, you know, falls at the right place.
Mm-hmm. Absolutely. So so how does codependence actually become physical illness? So when people give us these slights, when they give us this sarcasm, when they disown that they have done anything and they put it all back on us, and then we accept it. See, the other person, like I said, can't make us feel something, but they can project onto us and they can say, oh, you're too sensitive, as we said, you're misunderstanding, or you shouldn't be feeling that. When they say that, and then we have a choice as to whether we believe them or not. And if we believe them, then it starts to affect our self-esteem.
Right.
Our self-esteem starts to go down, and therefore what happens is we repress that energy. We are energetic beings, and we express our energy through body language, facial expression, voice tone, and the words that we choose. And when the other person expresses a negative energy about us, and we take it in, then that lowers our immune system. And that's the beginning of physical illness, is a lowered immune system.
Right.
So we just got notified again that we're at a break time. We're going to talk a little more about this fascinating topic. We want you to call us. Please give us a call whenever you can, 951-922-3532. Talk to you soon.
After commercial break.
Bye.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Robert and Dr. Mitra here, talking about codependency, independency, and interdependency, and how codependency can cause a physical illness.
Absolutely. So we were talking before about the different stages that people go through, the maturational stages, from dependency to independency to interdependency. And dependency is a stage where if your needs aren't met and people don't help you understand what's going on inside of you, and you begin to believe that other people make you feel things, then you end up in a codependent state later on.
Yes.
And you look to other people to make you feel good, and then you blame other people when you're not feeling good. And that comes from not having matured through dependency into full independency, where you can take responsibility for your feelings, and you say, this is my feeling, I own it, I created it, and if I don't like it, I have to learn how to deal with it differently.
Exactly.
Right. So what happens then is when we are codependent and we blame other people have all this power over us, and we feel as though we are victims of other people. And unfortunately, that's pretty prevalent in our society.
Yes.
Where there's a lot of litigiousness going on, where people are suing other people for things that really are not about what the other person did. It's about how that person responded to it, but the person doesn't take responsibility and wants to blame the other person, and then wants monetary damages, and that goes on quite a bit. But what happens then, of course, as an adult, is that if you're blaming other people and you feel as though you've been victimized by them, you're carrying a lot of what we called distress, right? There's eustress, positive stress, distress, negative stress. You're carrying a lot of that in your body. It's energy. Oftentimes it settles in a place in your body that you have a weakness in. So for a lot of people, they carry it in their neck and shoulders. Some people carry it in their stomach. There's different places where you feel weak in your body, and that's where that energy settles. And there's a whole process that takes place as physiological as to why that happens, which is beyond the scope right now of what we're talking about. But basically, that's what happens. We get into a place of distress, and we carry it in our bodies. And then if it becomes chronic and it lasts over a period of time, it can become chronic illness.
Right. Like eating disorders is one example of it.
Eating disorders are one addiction that manifests as a result of feeling chronic stress.
Right.
Right. Yeah. So, but what happens if there is abuse or neglect or physical or emotional abandonment when you're young? Then if there's abuse or neglect or physical or emotional abandonment, how much stress does that cause? And the answer is an awful lot.
Yes.
An awful lot.
Mean, we can't really put a numerical measure to it.
No,
it's just,
yeah.
It's just to the infinity.
Yeah, yeah. And so then people often grow up carrying that stress because they were treated disrespectfully at the best, and horribly at the worst, right? There were people who grew up with parents not only hitting them but actually beating them. There were children who grew up being told that they are horrible people, that they'll never amount to anything. There are people who have been tortured. Actually, their hands have been put on stoves. They've been put in boiling hot water. And then, of course, there's sexual abuse,
right,
which can be horrendous. So all of that, how does that affect a person? The person grows up with all of that negative energy, and the way that we can deal with losses like that, losses to our true self, is through grieving. And the grieving process is a process of releasing negative energy. So I'm working with a client right now, an older woman. She's in her 80s. She just lost her best friend, who was a man that she had a relationship with for 30 years, and maybe longer than 30 years. And it was her best friend. And she says, and she didn't know that it was okay to cry. So she would feel badly when she was crying, as though she was doing something, and I was encouraging her to cry and encouraging her to write to the man who's deceased, to get those feelings mobilized in her body and to release them through her tears. And I try to help her do that when we're in session, and whenever she does, afterwards she says, I feel lighter. And so, but we don't know that unless we're told that. And so oftentimes, if we're in a situation as a child and our parent is themselves emotionally damaged, our parent will give us messages not to cry. One of the famous messages, of course, is you cry and I'll give you something to cry about.
Yeah.
And the reason that the parent does that is because the parent themselves were abused, and they have so much sadness inside of them. And so when the child is crying, it touches that place inside of them that needs to cry and believes that they shouldn't and can't. And so they try to cut it off in the child.
Especially among boys.
Especially among boys, yeah. Girls are given more permission to cry, but boys are given more permission to be angry, and girls are given less permission to be angry. These are all legitimate forms of expression. Anger is a human emotion. It needs to be felt and expressed. But just like all emotions, being able to do it without shame and in a way that's not hurtful to that person or to somebody around them is the key, right? You don't want to be hurting others with your anger, but it's okay to be angry. Right. And it's okay to say, I'm angry with you.
Right.
Yeah. Usually people say I'm angry because they've been hurt first. And the hurt then morphs into anger. The anger is there to mobilize the hurt, to say, ouch, hey, that hurt. See, and there's the anger behind it. So that you can express the anger, but if you say I'm hurt, that hurt my feelings, and you say it in an angry way, the person then can perhaps it breaks through the other person's denial and they can hear it a little bit better.
So I mean, I want to say something, and please, correct me if I'm wrong. Uh, you're right. When we are angry, it is fundamentally because we have been hurt, right?
Mm-hmm.
So the anger can at times can serve as a defense.
It can.
As a defense, and also to create a safe distance between the person who's angry and the person that caused the hurt, or believes that the person caused the hurt.
Right. Exactly.
Right?
Exactly. Yeah. Yeah. So a lot of people are afraid of anger, and that's not because anger is a bad feeling. It's because anger has been misused.
And how it is expressed is the key point.
Right. Right. So if you don't have your anger available, oftentimes then you suffer injury because other people don't have to pay a price for injuring you. So they can injure you by being mean to you, or by talking badly about you, or to you, and so you get hurt, but you don't say anything, and that person then doesn't really know how badly they've hurt you, or maybe that person enjoys hurting other people, and they don't have to deal with any negative responses from the person because the person can't get angry. So our anger is actually okay depending upon how it's used.
Yeah, the same way, when we're happy, we make sure that everybody knows that we're happy. People become attracted to happy people, right?
Mm-hmm.
And then when we are angry, people kind of step back from us.
Right. So the grieving process is a process of releasing pain. If we've been injured at any time in our life, but especially if we've been injured at an early time, when we are infants, or when we're toddlers, young children, or even 11, 12, 13 years old, if we've been injured by mistreatment, by abuse, neglect, or abandonment, and again, abandonment can be physical or emotional, where the child is suffering and there's nobody for the child to come to help soothe the child, then the person is much more likely to have physical problems, physical illness as a result. And this brings up the issue of dysfunctional family systems.
Yes.
Because in a dysfunctional family system, the communication is indirect, and we don't talk about feelings. So the rules of being raised in a dysfunctional family may prohibit the person from expressing what's going on inside, which then leaves them feeling stressed. And after a while, the stress becomes their new norm. So they walk around stressed, and therefore their body doesn't function at 100%. It also may lead them to addictions, where they're trying to get relief from the stress, but because they're not aware of it, because the stress is old stress that they had from age 0 to 10, or 0 to 15, or whatever, and they don't recognize it because that's now stored in their subconscious, and on a day-to-day basis, their lives perhaps are now different, and they're not as stressed. They don't recognize that the old stress, which needs to be felt and expressed and grieved, is really connected with what's going on with them in the present.
Right. I mean, yes, when feelings are not processed, obviously, they just piled up. They, many of our clients, when we see here, they come in with one presenting problem.
Right.
But then again, once we explore that and open up the situation, we see old layers and piled up layers of unprocessed feelings and emotions and stress and all of that. And we see that how they are interconnected, and how they create a situation that seems to be just one issue, and then brings the person here.
Right.
And then one of the questions that's really a key factor is that, well, this seems to be not so new situation. what made you call us today?
Mm-hmm.
It just kind of, makes the clients think about, oh, so, it just, there is a connection between the unprocessed feeling and what happened right now that caused them to call. So they realize that this isn't really a new situation, but it's a new trigger that brought up all the old emotions.
Exactly.
And unprocessed feelings.
Exactly. So we've only got a couple of minutes, but I want to say about dysfunctional families a couple of things. There are rules in families that are consciously expressed, that we say this is the rule, but there's a lot of rules that happen subconsciously, where people just act a certain way, and that becomes a rule even though it isn't consciously set as a rule.
Right.
For example, it's not okay to talk about problems or to talk or express our feelings openly. That can be a rule that is not said, but it just isn't done in the family. So
behaviorally, it's been established.
It's been established behaviorally. Yeah. It's not okay to communicate directly to another person when you're upset. You need to communicate through another person, right? Indirectly to another person. That's another rule. So right. we find that happens. So we talk about gossip a lot, right? Gossip is talking about somebody rather than to that person.
I mean, how many times we have heard children say, but it's not easy to talk to my dad. It's not easy to talk to my mom.
Right. And another rule is don't be selfish.
Yeah.
Right. And don't be selfish is interesting, because we're all born to take care of ourselves, and taking care of yourself is being selfish. We're supposed to be selfish, right. But we use the word selfish in a pejorative manner as though it's a bad thing, rather than recognizing it's human nature to be selfish, but that doesn't mean we can't also be unselfish.
So let's talk about this more so then on the next program.
We will talk about it on the next program.
Yes, thank you. I'd like to invite you all to please join us next Friday, 9 o'clock, for another episode of the Codependency, Trauma, Addictions, and Relationship, and on Thursday at 3 p.m. for another episode of Human Sexuality and Sexual Healthcare. And until then, be safe, be well. All you need is love.
All you need is love.
Bye-bye.
See you next time.